Hi, I'm Dr. Suresh Patil. I am a joint replacement surgeon practicing in Pune at Jehangir Hospital. About my background, I was practicing in the United States for the last 15 years, and I'm also American board certified by ABPS and practicing for the last 15 years in the United States, specializing in robotic knee and hip replacement surgery, minimally invasive knee and hip replacement surgery, as well as revision hip and knee replacement surgeries. So I'm bringing the same standard of care that I'm using in the United States to the Pune at Jehangir Hospital, and will be providing the same American standard care and surgical precision to you, that will help you to regain your mobility back, that will help you to get the same treatment that you'll experience in New York or Pennsylvania, where I practiced in the past. And we're bringing the same robotic system that I'm using in the United States for last almost more than 5 years. We have performed hundreds of surgeries using this robot called Mako Robot, and I have done a lot of surgeries, complex surgeries, primary knee and hip replacement, and we got exactly what we want out of this robot. So this is the Mako Robot we are going to use in Pune to perform your surgery. This is the best robot I have ever seen or used. As we talked about, robot has a camera, that's the eyes of the robot, and this is the machine we used where the saw is attached to the robot. That saw cuts your bone very precisely, and it has a boundary where the saw doesn't cross that boundary. For example, if you want to cut this bone and the saw usually stops at the bone ends, it doesn't cross the bone ends, so it avoids damaging the soft tissues, damaging your ligament, damaging your nerve, arteries. So it is very well precise cutting of your bone. Now we will talk about the benefit of robot. We do traditional way of total knee arthroplasty, and we perform robotic assisted total knee arthroplasty. So what are the benefit of robotic assisted joint replacement, either hip or knee replacement? So let's start with the knee replacement. So robot, as we said, robot performs CT scan of your body before we go for surgery. That CT scan plan your alignment of the leg from your hip joint to your ankle very precisely. So you can align this component exactly in the line of your axis. So when the components are aligned very properly, then the load between the both sides of the joints are equal, and it helps for longevity of your implant. So your implant going to feel longer than performed without the robotic surgery, or performed without properly aligned knee replacement. So if you align your knee replacement in a very proper alignment, then the wear and tear of the plastic that we call polyethylene will be less. It will help you to lengthen the total knee arthroplasty compared to not properly aligned total knee arthroplasty. The second benefit is, since we are using robotic saw to cut your bone, we cut minimal of your skin, we cut minimal of your muscle inside the knee joint. So that's called minimally invasive surgery. So when you cut less muscle, when you cut less skin, as well as you need a less release of the ligament inside your knee joint, and that helps you to have a less pain post-operatively, because you are cutting the less tissues around your knee joint. So you will have less pain post-operatively. You will have a quicker recovery immediately after the surgery. You will be able to walk same day. You will be able to climb stairs next day, because you are cutting the less muscle. You are having less pain and less damage to your bones. This is also help you to return back to your routine activity very quickly, and help you to return back to your work faster than a traditional total knee arthroplasty. The other advantage is it helps you to avoid the complications around the total knee arthroplasty. It gives you the proper balancing of your ligament before you even make the bone cuts. So once we know the proper balancing of your ligament, we cut your bone and we put the implant. After putting the implant, it tells you how straightened your leg is. If it's stuck here, then we change our bone cuts and get the exact straight your knee. At the same time, we make sure your ligaments are well balanced mediolaterally that will avoid the complication we call instability. Same thing, we can check the similar balancing of your knee at 90 degree of your knee flexion, and we'll make sure that knee is strong and it's not loose, and we're getting the live demonstration or number on the screen of the robot. So it helps you to properly balance your knee, it helps you to properly align your knee, it helps you to cut less tissue around your knee joints, and indirectly it avoids the complication associated with the knee joints. Those are the basic benefit of total knee arthroplasty. Let's talk about the hip replacement. It's very helpful and important for the hip replacement. For example, this is your hip joint has a ball and the socket anatomy. So this is your femoral ball and the socket. As you can see here, the femoral head has a rough surface. That means you have arthritis of your hip joint. So when we perform robotic hip replacement, we have to align your component very precisely. When you perform your hip replacement, we have to align, for example, this is your hip. So we have to align your acetabular component in a 40 degree of horizontal and 20 degree of facing anteriorly, we call anteversion. So robot exactly puts your implant in 40 degree of horizontal inclination and 20 degree of anteversion. So if you put the component in a proper placement, then it helps you to avoid the complications like dislocations, because the commonest cause of dislocation, that popping the head out of socket, is malalignment of the component of acetabular side. So the robot helps you to put the component very precisely. The second benefit of robotic system is it helps you to balance your leg compared to the opposite side. It's giving you information that your surgery leg after putting the hip replacement is longer, shorter, or equal compared to the opposite side. And we get a millimeter numbers difference compared to the opposite side. So we can exactly balance your leg compared to the opposite side, and it avoids walking on unequal leg length gait. The third benefit of hip replacement is robot even plans the size of your acetabular component. This is the only robot which plans your size on a CT scan that we have done before the surgery, and it helps you to cut less bone from your pelvis, less bone from your acetabulum. For example, the robot is telling us that your size is exactly 48 millimeters, so you don't have to go to 50 millimeters. You can save cutting less bone and help you to precise exact size component into your socket. We have performed hundreds of surgeries using this technique, and every time we got the proper placement of your cup, proper placement of your leg length, and we can assess the stability of the hip. So if you put your acetabular component in a proper position and balance your leg and soft tissue tensioning very well, the complication of dislocation is significantly low. The complication of unequal walking gait is almost none, and it helps to avoid indirect damage to your nerves and soft tissue around your hip joint too. So overall, it's very beneficial to use robotic system to perform your hip replacement to get exactly what we want. The hip replacement surgery and knee replacement surgery is one of the most successful orthopedic procedure we performed in the orthopedic surgery. But if it's performed very well, then we can call as the most successful orthopedic procedure. But if it's not performed properly, if you don't perform soft tissue release properly, or if you don't put your implant properly, or if you don't cut your bone properly, then that surgery can fail and can cause complication after the surgery. So that's basic about the robot. Please reach out to us if you have any question or concern about robotic surgeries. My name is again Dr. Suresh Patil. I'm practicing at Jehangir Hospital in Pune, and will be available to provide the best standard of care that I'm doing in the United States in Pune for you. And please don't hesitate to contact us. Thank you.